Hi, I'm Rick. Welcome to my YouTube channel, Living with Paralysis. Today I'm going to show you a clip that I took out of part 1 of my first video. I did this because the videos seemed to get a little long, and my goal was to keep my videos to 30 minutes or less. This video pertains to it would be the definition of Guillain-Barré and Miller-Fisher syndromes. It'll explain basically how it can start, the effects of it, what can be done to try to slow it. And so that's going to be coming up here in this clip. And just to let you know that if you haven't seen part 1, my very first video, that I will leave that in the link in the description below. The source of the information I'm going to read to you comes from the clevelandclinic.org. Guillain-Barré Syndrome is a serious medical condition that can cause a range of symptoms, including muscle weakness. Usually begins in the legs, but can also start in the arms, face, or eyes. Weakness can affect both sides of the body. Tingling, numbness, or pins and needles in the hands and feet. Sharp shooting pains in the legs or back. Difficulty breathing, shortness of breath when lying flat. Difficulty swallowing or talking. Eye problems, blurred or double vision, or difficulty controlling eye movement. Abnormal heartbeat or blood pressure. Problems with balance and coordination or jerky coordinated movements. GBS symptoms usually worsen over the first 2 to 4 weeks. It's a medical emergency that requires immediate hospitalization before it can worsen quickly. There's no cure for GBS, but treatment can improve the chances of faster recovery. Treatments include plasmapheresis, hemoglobin, support treatment, and physical therapy. Recovery can be slow, taking anywhere from a few weeks to a few years. Some people may not recover completely and experience long-term weakness, numbness, fatigue, or pain. The exact cause of Guillain-Barré is unknown, but is thought to be an autoimmune disease caused by a problem with the immune system. In most cases of GBS occurs after a bacterial or viral infection, such as the flu, a stomach bug, or gastroenteritis caused by bacteria. During an infection, the immune system usually attacks and destroys the virus or bacteria. But in GBS, it mistakenly attacks the body's own nerves. This is thought to happen because the chemical or bacteria and virus are similar to those on nerve cells. In rare cases, some vaccines may increase the risk of developing GBS. For example, in 2021, the FDA warned that there may be an increased risk of developing GBS within 42 days after receiving the Johnson & Johnson COVID-19 vaccine. However, the risk of developing GBS from a vaccine is much lower than the risk of developing it from the infection it prevents. In some cases, surgery can trigger GBS. GBS is not contagious or inherited. It can affect anyone, but it's more common in adults and males. GBS is rare. In the United States, the CDC estimates that 3,000 to 6,000 people develop GBS each year. Worldwide, about 100,000 people develop GBS each year. There isn't a cure for GBS, but some therapies can stop your immune system from attacking healthy nerves. The most common treatment include intravenous therapy called IVIG. IVIG therapy uses purified plasma, the liquid portion of your blood, and healthy antibodies from donors. It can help prevent your immune system from attacking healthy tissue. The second one is plasma exchange, or called plasmapheresis. Plasmapheresis is a procedure to filter your blood of plasma that may contain harmful antibodies. Now I'm going to go on to explain the Miller-Fisher syndrome. The Miller-Fisher syndrome is a rare disorder that causes your immune system to attack the nerves, much like GBS. Usually starting in your face, it can affect the nerves that control your eye muscles, so you may have trouble moving your eyes. MFS also can cause problems with your coordination and reflexes. Symptoms usually follow a viral or bacterial infection. Who gets Miller-Fisher syndrome? Anyone can get Miller-Fisher syndrome, but it's more common in people of Asian descent. It affects men twice as often as women and adults over age 55. The difference between Miller-Fisher and Guillain-Barré syndrome. Miller-Fisher syndrome is a form of GBS. Like MFS, GBS is an autoimmune disease triggered by an infection. But MFS tends to affect your upper body first, whereas GBS typically affects your lower body and then spreads upward. Common symptoms of GBS include back pain, breathing problems, and muscle weakness in your feet, legs, and hands. GBS is also more common than MFS. MFS is not contagious, so it doesn't spread from person to person. MFS syndrome is very rare. It affects about 1 to 2 people per million worldwide. The symptoms of Miller-Fisher variant tend to come on suddenly and develop over a few days. Symptoms usually start about 10 days after a viral or bacterial infection. Sometimes your symptoms may not appear for several weeks. The most common symptoms of MFS include balance problems, change in the way you walk, double vision or blurred vision, drooping eyelids, facial paralysis, loss of tendon reflexes in your ankle, knee, or arm, problems with eye movement, sloppy or clumsy muscle movement. You may also develop breathing problems, muscle weakness in your arms and legs, swallowing problems, tongue weakness. The causes of Miller-Fisher syndrome. MFS can develop if your immune system reacts to an infection and mistakenly attacks nerves while it's trying to fight the infection. Viral and bacterial infections that may trigger MFS include influenza, HIV, Epstein-Barr virus, and Zika virus. Is Miller-Fisher syndrome hereditary? MFS may be inherited, passed down from parents to children, but it's rare for 2 people in the same family to have the disorder. Diagnosis and testing. There isn't a test that can confirm a diagnosis of MFS. Your healthcare provider will perform a physical exam, evaluate your symptoms, and review your medical history. Be sure to tell your provider if you've had a viral or bacterial infection in the last several months. If your provider suspects you have MFS, They may perform the following tests. Blood tests can detect high levels of certain antibodies in your blood. Antibodies are proteins your immune system produces to fight infection. Electrotomography is a test that measures how well your muscles are responding to signals from nerves. Nerve conduction study. This test measures how quickly an electrical system moves through your nerves. Spinal tap. During a spinal tap, lumbar puncture, your provider removes a sample from the fluid surrounding your spine and examines the fluid for certain antibodies. How Miller-Fisher syndrome is treated. There isn't a cure for Miller-Fisher syndrome, but some therapists can stop your immune system from attacking healthy nerve. The most common treatments include IVIG, same as GBS, and plasmapheresis. Prevention. There is no way to prevent Miller-Fisher syndrome, but you can take steps to reduce your risk of getting a viral bacterial infection. Be sure to avoid contact with people who are sick. Cover coughs and sneezes. Disinfect surfaces that you touch often. Don't touch your face unless your hands are clean. Wash your hands often and use hand sanitizer. The outlook for people who receive treatment for Miller-Fisher syndrome is good. It's rarely fatal and usually doesn't cause any serious or long-term health complications. Most people recover within 2 to 6 months. See your health care provider immediately if you experience any issues with your reflexes, coordination, or muscle movements. The symptoms of MFS can be similar to those of other disorders that affect your nerves and muscles. A note from Cleveland Clinic. Noticing problems with your eyes, muscles, or balance can be scary. In most cases, these symptoms don't mean you have MFS because the disease is so rare. But they're signs that something isn't right. So it's important to talk to your healthcare provider right away. If you experience any of these issues, your provider can test to check your muscles, nerves, and overall health before designing a treatment plan that best fits your needs. That's it for now. Please click on the like and subscribe button, and we'll see you in the next video. Thank you. Bye.